Nigeria Center for Disease Control and Prevention, NCDC, and its partners has conducted in-country review on implementation of antimicrobial stewardship programs in Nigerian hospitals. The antimicrobial stewardship programs is aimed at assessing the rationale of overuse of antibiotics and the need for behavioral change in prescription patterns amongst healthcare workers. Here's the rest of the story.
Data has shown that an alarming 250,000 Nigerians die each year due to infections that no longer respond to treatment, a figure higher than HIV, AIDS, and malaria combined. To address this, the Nigeria Center for Disease Control and Prevention, NCDC, in collaboration with key partners in 2017, launched the Commonwealth Partnerships for Antimicrobial Stewardship Program in Nigerian hospitals to curb antibiotic overuse. At the in-country annual review on implementation of this program, the Antimicrobial Resistance Program Manager, NCDC, Dr. Ridwan Yahaya, explained that inappropriate antibiotic use, especially at healthcare facilities, is a major driver of growing antimicrobial resistance. He said the NCDC has piloted community-based programs by educating patients, medicine vendors, and pharmacists on appropriate antibiotic prescribing and dispensing.
As a country, we piloted a community-based stewardship program where we targeted PPMVs, meaning patent and proprietary medicine vendors, the community pharmacies, to educate them on the rational prescription and, of course, rational dispensing of antimicrobials. Sometimes people just walk into the pharmacies and then buy any antimicrobials without prescription, without any diagnostic test done. So we create awareness among community pharmacists and, of course, other stakeholders, to ensure that antimicrobials are protected, they are not abused, they are properly consumed by those who need them. At the end of this implementation, we hope to use the lessons learned from these 5 hospitals to see how we can improve on the national programs to other facilities who did not benefit from the funding of the CW pumps.
The chairman and technical working group AMR in Nigeria, Professor Dipo Aboderin, said Nigeria can prevent over 50,000 deaths associated with infections through measures like water, sanitation, and vaccination.
If you must treat in a responsible way, establish a diagnosis, know what agent you are, you know how long you should use. It's not that you treat now and then somebody else is say, I have leftover antimicrobials without even making a diagnosis to use. So those are things that, so we know what, in fact, just last week, like I mentioned, the Lancet Paper Commission also came out that we already know what can be done. And that's if what the tools that we have in hand, for instance, if you can prevent infection, water sanitation, vaccination, if you can do all that, 750,000 of all this infection can be prevented annually, which is huge. So if we deploy all that we know, like we did during COVID-19, everybody was conscious. If we continue to do it and other measures, we will be able to prevent this burden of untreatable infections.
Progress was reported in building diagnostic capacity, while calls were made to advocate for expanding the fund program to more Nigerian hospitals.
So in terms of the common man, the program is a health partnership program under the THET, which is the Tropical Health Education Trust. And what they're trying to do is a health partnership and bilateral learning where we have hospitals in Nigeria, facilities in Nigeria learn from other facilities in the UK. So what we're trying to do, like you said, is really see how we can impact the common man. So the program is currently run in 5 sites. And one example I can give of how it impacts the common man, one of the facilities, for the first time in the history of that hospital, they've been able to identify the organisms that are causing some infections at the hospital. So before, they'll just be able to treat as a general. It's called empirical treatment. But after this program, they're able to identify the specific organism and use the right antibiotics, which has the impact on treating people, saving lives, and of course, saving a lot of cost as well on wasted, antimicrobials that is not required.
5 Nigerian hospitals are currently participating in an antimicrobial stewardship initiative funded by the UK-based Fleming Fund. NCDC said lessons from these pilot sites will help strengthen the nation's efforts.
Now, no fewer than 5